Folks, thanks for coming on the line with us today. My name is John Dubas with Premier Marketing, and we'll be spending the next 45 minutes or so, 45 minutes to an hour, discussing some of the portfolio with Aetna, and specifically their senior supplemental programs, where we're looking to go beyond just the basic health care that a Medicare beneficiary sees and has. What we're looking to do is make certain not only do we offer good Medicare supplement or other healthcare choices, we also want to make certain that any of the gaps that aren't covered by the programs in the base set, we have an opportunity to offer additional coverage so there aren't surprises for our prospects and clients down the road. We'll be recording today's presentation. If you have questions, please put them in the questions box in the software. We'll make certain that we address them at the end of the presentation, and also they will be sent out with the follow-up that will go out to everyone who expressed interest in today's webinar. So expect that as soon as we get the recording of the presentation uploaded, and hopefully that'll come to you today or tomorrow, hopefully at the latest. A little bit of background as we get started. Give you some information about Premier Marketing if you're not familiar with us. We are a national marketing organization founded in 1968. We're part of the Integrity Marketing platform with offices across the country. And we act as an insurance wholesaler, providing different insurance programs through independent insurance agents such as yourself. We offer those contracts at the highest possible commission levels with recruiting of contracts available to those who qualify. As we mentioned, we were founded in 1968, so even though we've nudged into 2020 now, it's a recent 50th anniversary of our organization, and that's a really kind of a huge accomplishment for what started as a family-owned organization in rural Nebraska. It's grown into one of the largest organizations of its type in the Medicare space for both Medicare and Medicare Supplement and Medicare Advantage programs and ancillary programs as well. And that's all due to our relationship with and work with agents such as yourself. We do so through a full insurance portfolio that covers the gambit of the base coverages for those on Medicare, including Medicare Advantage programs, Medicare Supplement programs, and the standalone Part D prescription drug plans. We also offer a full portfolio of life insurance and annuity products, including final expense life insurance and pre-need plans, long and short-term care programs, disability income programs, and ancillary benefits, including dental, vision, hearing programs, critical illness and cancer plans, and hospital indemnity programs. That Medicare Advantage portfolio includes all the national carriers, including also many of the regional carriers that make a difference to you in your community. That same philosophy carries over to the standalone Part D prescription drug programs, where those name brands are there for your use through our organization to address the needs of your prospects and clients. Medicare Supplement portfolio is very large and robust, and we have specific tools to help you be successful in that space as well. The ancillary products include the leaders in each of the categories, and our special featured guest today not only offers a strong Medicare Supplement program, but also many of these ancillary products that we'll speak to today. When we look at the Medicare market, it is a portion of the world where you don't come on a webinar like this without someone like me telling you about the baby boomers aging in to the Medicare space. 10,000 a day, what is it, so many per second, all those lovely statistics that come into play. But if you look at the Medicare program based on just age, you're missing part of that market. Some of the folks that age into Medicare continue to access benefits elsewhere through work or other programs, but you also have about a sixth of the population on Medicare that aren't 65 qualify for Medicare based on disability, and some of those folks, even with disability, can qualify for extra programs that we'll speak to today, because that is a diverse population in that space. Many of the folks have challenges with their bodies. The average Medicare beneficiary has 3+ chronic conditions, and they are sometimes a bit handicapped when it comes to income and savings as well. So helping them prepare for the inevitable, the challenges with their bodies, it's important to have programs such as we'll discuss today to help them budget for those situations as they grow into them. When someone does enter into the Medicare program, they do have choices as to what they can do. The first choice is do nothing. Not a very smart choice, but the decision to make a decision is a decision. An old manager with Prudential used to tell me years and years ago, and many of those folks choose to self-insure, and some of them don't even pick up the Part B coverage of Medicare. They have some challenges, needless to say. Some of them will only pick up the drug coverage, but many will also pick up the standardized, modernized coverage that you get with Medicare Supplements. And those are part of today's presentation as well with Aetna. We'll also speak to, in reference in passing, as we have the Medicare Advantage option, which is basically accessing your Medicare benefits through the private insurers that then are responsible for all the claims that a person has with Medicare. And in many circumstances, they roll in the drug coverage into these programs as well. It's a pretty even choice as we go along. When people have a selection, you'll see, according to the DEF research we quote here, that's a pretty even choice between Medicare Advantage and MedSup. And then there's that population that's done nothing, as I mentioned before. Those are strong prospects for us with many of the programs that we offer. And then, of course, MACRA is influencing some of the choices for those just getting into Medicare now because of a piece of legislation that was passed back in 2015 that's just effective the first of this year, which limits certain choices with Medicare supplement types. Aetna is very good about supplying the information we need to understand the Medicare Access and CHIP Reauthorization Act of 2015, MACRA, and does a number of things for us with guidelines that help us understand who can qualify for what and when, and therefore also makes it available to us in video form too. So some really nice pieces that will come to you also as part of the follow-up to today's presentation. And this chart gives you an idea of who can get what now, because keep in mind, those CNFs don't go away, and some folks, it may still be the best choice for them. It's just the newly eligibles that can't pick up that coverage. And it's important to note too, that one size doesn't fit all. So we need to be careful and be thorough in our discussions with our prospects and clients so we can help them align most closely with the choice that might be best for them. So what we'll do at this point in time is turn today's presentation over to our guest speaker. I'd like to introduce Mr. Kevin Moore. He's the Regional Vice President for the South with Aetna Senior Supplemental Products. And he is going to lead us through the portfolio that's being offered by Aetna. And at this point in time, I'll shut up and turn it over to you, Kevin.
Thank you, John. Thanks, everyone, for taking the time out of your busy schedule to spend with us today. John, can you confirm that you can see my screen now?
Yes, sir. I'd already muted myself. Sorry, but yep, can see it fine. Lovely
Okay.
purple.
Thank you. Thank you. Thank you. So, again, thanks for taking some time out of your day to spend with us. One thing I always like to mention before we get rolling on a presentation like this is your line is muted, so you can't speak back directly to us, but you can utilize the tools within the webinar application to ask questions and things like that, which John and I will try to address as many of those as we can at the towards the end of the presentation. So with that, I will get rolling. Want to first just share with you my contact information and let you know that if you ever have something pop up regarding any of the products or anything related to Aetna Senior Supplemental Insurance, you're welcome to give me a call. My phone number's here. That's my cell phone and my office phone, so call or text me. And of course, you can email me as well. And despite what it says there about me being located in Franklin, Tennessee, that's actually the location for our home office, which I just noticed I have the old address on there. I need to update that. But I actually live in the state of Texas, in the Dallas-Fort Worth area, because that's part of my region and where I spend a lot of my time. As you can see, I cover the states in the bottom left-hand corner there. It's about 8 states, all in the southern portion of the country. And then not only do you have me, but you also have Justine Sawyers and Suzanne Gilbo, who assist me on my team. We're here to help and support you, and feel free to take note of their contact information as well if there's anything we can do to assist you, especially if you're in any of those 8 states. But if you're not, that's okay. We're here to help and support you anyway. And by the way, one thing I always like to make sure that I mention too before I start getting into products and things like that is our website. So, a lot of times people get confused about where to find information on our products. Maybe it's on, Producer World, which is more on the Aetna MA side of the business, or on Aetna.com. But actually, everything under the Aetna Senior Supplemental portfolio of sales will be AetnaSeniorProducts.com will be the location that you can get in and find out more information. Again, AetnaSeniorProducts.com. And with that being said, just real quick recap. Our home office is based in the Nashville, Tennessee area, actually in a suburb called Franklin. If you've ever been that way and you've driven through Franklin, you probably know where I'm talking about. If you ever find yourself in the area and would like to come by and visit us, let me know. I'd be happy to set up a tour with some of our staff. We've got a very dedicated agent services team. We're focused on business persistency. It's important for you and important for us as well. We try to do our absolute best to bring you not only great products, but competitive premiums as well. We know, especially in the Medicare Supplement business, that having a competitive premium is part of what gets you recognized in the marketplace. So we do as much as we possibly can to stay very competitive, and we generally are. Top commissions and growing renewals. We not only have our Medicare Supplement, but we have a complete lineup of other products that are designed to help and support the senior market, which we'll be touching on most, if not all of those today. We've been around for over 35 years. We only have about 400 to 500 employees, so we're not a huge company. And we've got over 30,000 licensed agents representing our product today. Also want to mention real quickly that we're an A-rated company, so you're representing one of the best. We also operate under 4 separate charters or entities, which you see listed here. I know it sounds, if you look at these, like they're different companies, but they're all part of Aetna Senior Supplemental Insurance. Those are just different names that we used to file products under. Again, they all fall together under Aetna Senior Supplemental, though. Here's just a quick list of all the products that we have. We've got our Medicare Supplement, our critical illness plan, which is called Cancer and Heart Attack or Stroke Plus, a hospital indemnity plan, dental, vision, hearing, home care and recovery care, and then, of course, a final expense product as well. So just want to touch real quickly on our Medicare Supplement. We're available just about every state in the union with a few exceptions out there. If you see dark purple or light purple, that means that we have a product there. Just a few exceptions out there. Those are generally going to be states where Medicare Supplement's not a big option for most anyway. So why would you want to work with us and represent our Medicare Supplement? Well, among several reasons. Not only that we're backed by Aetna, and now Aetna being owned and operated by CVS, 2 large industry giants who are focused on bringing the best in healthcare. Specifically with us, you get a broad choice of plan. Your coverage is portable, meaning that if you move, you get to take your plan with you, and you're never going to be re-rated based on a new address or new zip code, which can be a big thing, because if you move into an area where it's more expensive to get a Medicare Supplement, you can always still be based on your old rates. It's guaranteed renewable. We don't cancel your policy, unless as long as you pay your premiums, you can keep your coverage. We do not have a pre-existing condition clause of any type. As long as you're accepted as a policy holder, then you will be covered immediately for all conditions and illnesses. I mentioned this before, but I'll say it again: competitive commissions, competitive premiums, and then we do lots of sales incentives. John touched on this a little bit already. I just want to kind of piggyback off of what he said and just talk about MACRA for a second. As we all know, this went into effect on January 1st of this year. So under MACRA, you've got to think about it like this. There's basically 3 different types of clients. One, you're going to have those who held a Medicare Supplement policy prior to the change, prior to January 1st. Those that became eligible on or before the end of last year, December 31st of last year, or those that became eligible on or after January 1st of this year. The first one, I'll just say, your current policyholders, anyone who had a policy prior to January 1st, there's no change to them. They're not really affected by this change. Now, the next group of individuals or clients would be those who became Medicare eligible on or before December 31st. And that could include those that already had policies. So what you want to take note of here, and it's in the middle box there, it's got a 2 underneath it, is everyone who became eligible on or before December 31st of last year, they always will continue to be able to choose the plans that were available before that date. So they can still always choose a Plan F. So if you have anyone out there who's been on Medicare and was on Medicare or became eligible for Medicare prior to the end of 2019, they'll always still be able to select all the plans that were available before. So they can still go to a Plan F. And then you have those that became eligible on or after January 1st of this year. You see the plan choices there are limited. They don't have F really as an option anymore. It's kind of the main big difference there. So anyone who's going to become eligible on or after the 1st of this year will have the choices that you see there, A, B, D, G, N, and high deductible G if it applies in their state. So what's the impact on the market of this macro change? Well, the way Aetna sees it is your Plan F is actually going to become a new, more stable and very competitive. That's what we've done. Actually, we launched several new states with new Plan F rates just before the end of the year. And what it's going to do, since a lot of the older, the guaranteed issue business, I won't say older, but future guaranteed issue business will not be going to Plan F. And our Plan F, where we launch new ones, is going to become a more or mostly underwritten block of business. So it's going to help become a much more stable rate. A lot of the larger increases you've seen on Plan F in years past were attributed to the amount of guaranteed issue business that was going on that block of business. So now, with it being a newer block of rates in several states, about 20 states we have out there that are like this. And you'll kind of see that on the map that I'll show you here in a moment. You're going to see that Plan F is going to be a better, more stable block of business. Now, the way we see Plan G going forward is with it taking on a higher rate of guaranteed issue business now, you're going to see higher rate increases on your Plan G going forward. So in a lot of ways, it means a kind of a flip or a switch for the market. For years and years, all we've talked about is how great Plan G is and how it's such a savings. And yes, if you look at it today, Plan G is still a great plan, and it's going to continue to be a great plan. But I think over time, you're going to see higher and higher rate increases because it's going to be taking on a lot more guaranteed issue business. And just to clarify real quickly, since we're talking about, I've said guaranteed issue several times, when I talk about guaranteed issue, I'm not really referring to open enrollment. Open enrollment is a different type of business. Open enrollment is going to be someone who's turning 65, and that's all well and good. But when we talk about guaranteed issue business, usually it means someone who's lost coverage through no fault of their own, and they aren't healthy enough to be able to get an underwritten plan. So they're considered guaranteed issue. Generally speaking, that means that you're taking on business that's going to be very expensive, and it's going to cause higher rate increases because it's generally going to be someone who's not very healthy. Hopefully that makes sense to everyone. And then the other option here that we'll discuss for a few moments is Plan N. From my perspective, from Aetna's perspective, we've seen this macro change coming for quite a while, and we started preparing by getting a very competitive Plan N into the marketplace. I personally feel that Plan N is kind of the future of Medicare supplements, at least for the foreseeable future. It's a plan that creates a little bit more risk for your client, for your policyholder, not a lot, but a little bit more risk, which therefore drives down the usage and utilization, which therefore helps control and stabilize the rate. So it allows you as a policyholder to get a lot better deal in terms of your monthly payment. And for the foreseeable future, again, because of the stability of the plan, it's going to be going forward a much more stable rate book and a stable set of rate increases in its future as well. So that's kind of our take on it. Plan F in the states where we have new ones, They're going to be stable and good, and we're going to continue to try to get new Plan Fs in most of the states. It's going to be mostly an underwritten block of business, which means it creates a lot of stability. Plan G, great plan still, will continue to be a great plan, but over time you're going to see higher prices on Plan G. And then Plan N, kind of a little bit of a hybrid plan in some ways. There is a little bit more risk for the policyholder, but much, much more stable and lower rates. So I mentioned a minute ago, Aetna began preparing and planning for MACRA up to 2 years ago. And one of the things we did was create this, new different ways to look at Plan N, and that, happened through educating the field, which we spent a lot of time talking about with different distribution partners about how Plan N, and that's resulted in good things for us because we saw about a 30% increase in Plan N sales over the last 12 months. And what we also did is we launched a very competitive Plan N across most of the country. And here's a recent heat map that I pulled that just shows where we rank, and this is based on an age 65 female for a Plan N. Anywhere where you see lighter colors, blue or green, that means we're very competitive. And actually the dark blue is going to be the most competitive. Light blue is going to be also very competitive. And then the dark and light green are competitive as well, just not quite as much as the blue. Where you see the warmer colors like the yellow and the orange, we're not as competitive on Plan N. Doesn't mean that we don't have good other plans there. Maybe it's F or G, but we don't happen to have a really strong Plan N where it's yellow or orange. Doesn't mean it's a bad plan, just maybe there may be some, one or two competitive carriers that are undercutting us by a few dollars in those warmer color states. So by and large, you can see most of the map does have very competitive rates for us on Plan N. And again, that was by design. We wanted to roll out a plan that was going to bring some excitement and some energy and also bring in some new business. And Plan N has been doing that for many, many months, and it's going to continue to do that going forward because of the competitiveness of it. And then here's the same map, but I applied with the household discount. You can see the colors don't change a whole lot. One other thing that we did to help incentivize Plan N sales, you can look here, 23 states, we increased commissions on Plan N across the board. So, Plan N has a lesser rate, which means that typically that's lesser commission for the agent. Well, we didn't want to punish an agent for saving their client money and helping put a more stable plan in the market. So we offset it by increasing the commission by 5% in these 23 states. So when you write a Plan N here, you're going to get paid as much or about the same, if not more, than you would for writing a Plan G. And if your state's not on there or a state that you write in, just stay tuned. It may be announced in the next, few weeks or months. We're working to put that increase in place everywhere if we can. The next thing we did, other than Plan N, and I won't go into details on how a Plan N works at this point, but if you have questions on that, please let us know. That's kind of a whole different presentation. So the other thing that we did in addition to the Plan N was roll out this competitive Plan F, which I referred to. It wasn't in every single state. We've still got some states to work on. The color scheme works the same here on this. This is based on an age 65 female. If you see blue or green, especially blue, that means we're highly, highly competitive. The warmer colors, not as much, but it may just mean that we haven't launched the new Plan F there yet. Probably will be coming soon. So that gives you an idea of where you can really take advantage of the Plan F. Now, I'm not saying that in any particular state we don't also have a great Plan G rate. We do in most states as well, but we also have great F and great N plans in quite a few also. And I noticed that I didn't change the slide on this at the top that says N. I was kind of putting this together this morning. I overlooked that, but it is F is what we're looking at. All right, so moving away from MedSup a little bit, let's talk about some of the other opportunities you have with Aetna products. I always like to ask everyone these questions. I know you can't speak back directly to me, but maybe you'll answer out loud anyway. So just my questions to everyone on the line. The first one is, are you in this business because you love to help people? I'm going to assume everyone's answer is yes. I've never been in a room or over the phone with someone doing this presentation who didn't say yes. That's my answer to the question. I really enjoy helping people, and that's why I do what I do. And I'm assuming it's the same for most of you as well, if not all of you, hopefully. So that's my first question. The second question is, are you also in this business because you want to make a living? I'm going to assume that that's a default yes for everyone as well. It's a yes for me. I do what I do because I love doing it, love helping people, but I also know that's at the end of the day how I pay the bills, put a roof over everyone's head, and put clothes on the kids' backs and all that good stuff. So the reason I ask these two questions is I find that a lot of times in the Medicare business, we've got agents who are working hard to do their best to help their clients, but then they're leaving certain things uncovered. They're not necessarily always going that extra step to make sure they have the cancer policy they need or have the dental policy they need. And I just think it's frustrating because we're in this business, like we all said, because we love to help people. And then we're also in this because we love to make money. We know that this is how we make our living. So let's take that extra step and educate our clients and then provide solutions. And that's what all of our additional products outside of our Medicare Supplement are really designed to do. They're designed to enhance, generally speaking, a senior's coverage. Not always going to be for seniors, as some of you well know. Underage clients need help too, and a lot of our products will work at the younger ages. So let's educate and provide solutions. And here's just sort of some fun facts that I came up with. Some of these are getting to be a little out of date, but they do kind of help put the picture in the frame, in my opinion. So real life certainties. Did you know that 71% of those who are 65 or older did not have any type of dental coverage in 2017? 71%, that's a huge number. And I'm sure that number hasn't changed a whole lot over the last few years. There's lots of opportunity for us to help our seniors get the type of dental care that they need. Cancer, did you know that 42% of the costs associated with a cancer diagnosis are indirect? What that means is they're not covered by any type of medical insurance. They're typically going to be costs that are just straight out of pocket. We have a cancer plan that can help with that. It's just a matter of educating your client and providing that solution. Take that extra step and do it. It's good for your client, helps them, which we all love to do, and it helps you make a living, which we also love to do. Did you know that if you need to spend time in any type of facility, such as an assisted living, it's going to cost on average about $3,750 a month. If you need to spend time in a nursing home, it's about $7,150 a month. That's for a semi-private room. Add another $100 or so, $1,000 a month if you want to have a private room. We have plans for that. There's a stat, and I don't have it in this presentation, but it's that 72% of those who are 65 or older will end up spending at least some time in an assisted living or in a nursing home. That is very expensive. You may have coverage that helps pick up some of that, but by and large, you're probably going to spend more time than what coverage you have. We have small, affordable plans that are designed to do exactly that. Did you know that almost 40% of adult Americans are not able to cover a $400 emergency and pay it off quickly? That's a huge number. A lot of times those emergencies are more than $400 or they are medically related. We have plans that are there to help you when you need it most, to help put money in your pocket when you've got to have it. 1 out of 4 adults skipped necessary medical care in 2018 because of affordability. I'm sure some of us have been there before. I know a lot of us probably have been. You don't want to go to the doctor because it's going to be expensive. Well, we don't want to create that scenario for anyone, especially our seniors. So there is plans in place that will help. And then last but not least, an average funeral costs between $7,000 and $9,000. And that's, unless you have a plan for that, there's really no coverage. We have a final expense plan. I'm not going to spend a lot of time on it today, but we do have one, and it's really easy to work with. Types of policies and how often they're utilized. Did you know that if you have a homeowner's policy, which all homeowners typically do, then you only have a 0.04% chance of ever using that policy, filing a claim on that policy. Very, very small, a fraction of a percent. Auto policy, same thing, 0.06% chance of ever filing a claim. I look back, I've been driving for over 20-something years now, going into 30 years, and I can only remember filing 1 or 2 claims and they actually weren't my fault. It was claims against others. So, we all got to have auto insurance, which is important, obviously, but the chances of actually using it are not very high. Did you know that if you have a cancer policy, you have about a 40% chance of filing a claim? Much, much different. Why do we all not have cancer insurance? The chances of having it are extremely high. If you have a long-term care policy, you have about a 70% chance of filing a claim. And of course, dental is about a 100% chance, and then final expense, of course, is the same, 100% chance. There is policies out there to help in these cases, and that's what we're going to spend some time talking about. We call them our ancillary products, our complementary products, our protection series of products. They go by many names, but they are designed to help you and help your clients. And real quick, before we jump into the first product, let me also mention this. This has a big effect on your ability to retain your customers. Persistency is a big concern in this business. We work, hard to get clients, and it's really frustrating that we can just lose them on a whim. Well, do you know that if you can add multiple products or policies in the client's home sold by you, it ups your chances of keeping that client? They say that on average, if you can place one policy, you've got about a 55 to 60% chance of keeping that client. If you can place two policies, it goes up to about a 70% chance. If you can place 3 policies, it goes up to about an 80% chance. Make sure you're taking care of your clients top to bottom. It doesn't matter if you sell them a Aetna dental vision hearing and a United Medicare Advantage, or vice versa, or maybe it's a Med Supp and a hospital indemnity, or whatever the case may be. They don't have to be the same brand. I want you to know that. You do what's right for the client, but don't forget, if you can put multiple policies to cover all their gaps, that's going to make it all that much more likely that you keep that client. With that being said, let's talk a little bit about our cancer and heart attack or stroke insurance plan. The risks for being diagnosed with these types of illnesses are very high, as I previously stated. Cancer is the second most common cause of death. 87% of all cancers are diagnosed in persons 50 or older. So as you approach the senior time of your life is when you're most likely to be diagnosed. Every 2 minutes a child is diagnosed, though. So it's not only for older individuals. Anyone can be infected by this. 41% of men and 38% of women will be diagnosed during their lifetimes. If you really think about that, what that's saying is one out of every 2 men and 1 out of every 3 women. I'm sure there's a lot of men and women dialed in on this phone call. Many may have already been affected by cancer, but we also may still be. The chances of you being diagnosed are very high. Any of us. There is coverage in place to help, because it is also, by the way, very expensive to deal with the costs associated with treating it. Heart attack is the number 1 cause of death in our country. I think we had a typo there. Responsible for 1 out of every 4 deaths. About 720,000 Americans will have a heart attack this year, and of course, 70% of those are going to be their first heart attack. Again, very expensive to deal with. Whenever you're dealing with one of these big-time illnesses, whether it be cancer, heart attack, or stroke, the last thing I know I want to have to worry about is money. And that's exactly what these plans are designed to do. Stroke's the 3rd leading cause of death in women and 5th in men. Half of all men and 1/3 of all women will develop cancer during our lifetime. I didn't even check these. Someone else typed these up for me, and I guess they got them out of order. I apologize. So the stats are what they are. And by the way, if you're ever marketing one of these products with us, notice that these facts, and they're usually going to be very up to date because we try to update them as quickly as they can. They will be in the brochures for our materials. So just make sure that you take advantage. And what I like to do is, if I'm presenting this to a client, is just lay it out on the table in front of them and say, hey, here's the risks that are involved with these types of illnesses. So here's the way our product actually works. You can write it on anyone between the ages of 18 and 89. The coverage can be for an individual, or it can be for an individual and a spouse or domestic partner. It can be an individual and children. That's going to be for like a single parent. Or you can do a family plan. Family plan is going to obviously cover, like a 2 head of household, husband and wife or whatever the relationship may be, and then any children they have under them. And it doesn't cost more to have additional children added to the policy. You know, if you've got 1 or you've got 12, the cost is the same. Just FYI on that. Benefits are going to be paid upon diagnosis, and they can start with a benefit amount of as low as $5,000 or take it as high as $75,000. I personally have a $50,000 policy for me and my family. So if any of us are diagnosed, then we're going to get that benefit. It's the same lump sum amount for each covered person on the policy. The policy itself will pay out one time per occurrence, and you can have one for cancer, and then you can have one for either heart attack or stroke, not both. So you can get up to 2 benefits. And then we actually have a rider that you can add on to this for recurrence. It's only a few extra dollars a month in premium, but what it can do is if you, let's say you're diagnosed with cancer, you get your benefit. Well, with that recurrence rider, you're going to have the ability to get a second benefit if you're diagnosed with cancer again, or heart attack, stroke, vice versa. It's this, I already said that. It's designed to help offset your out-of-pocket expenses. No hospitalization is required. There is a 30-day waiting period from the time you buy the policy, so make sure you tell your client if you're writing this, you know, now is not the time to be diagnosed with anything, so we'll have any major tests ran or anything like that. One thing that is very unique about our product versus some of the competitors out there is that if you write a couple or a family, the youngest spouse, if there's, you know, if it involves a married couple, is going to be able to be the primary on the policy, which means the rates will be based off of that person. We run across scenarios before where there's almost a 25 to 30 year age gap between a husband and wife. That younger person can be and should be always, and when you're writing these, the primary. The rates will be based on that person only. That's a big savings, and there's no other carrier out there that has that ability on this policy, just so you know. So that's it on the cancer, heart attack, stroke. I didn't want to spend too much time on it because I wanted to hit all the products. I could share a lot more with you, but I want to kind of move forward. And again, we can always follow up later on at the end of the call with questions or anything you have regarding this product or any of the others. So we also have a hospital indemnity plan. Hospital indemnity, for those who may not be aware, is designed, really, we've designed ours to match up perfectly with a Medicare Advantage plan. You know, I think anyone in this industry who's out there signing people up for Medicare Advantage is aware that, you know, there's some places there where if and when the policyholder gets sick, they're going to have some significant out-of-pocket costs. So this plan is designed to be paired specifically with a Medicare Advantage plan. It will pay the policyholder for hospital admission stay. It will pay them if they want to be daily. And you can also cover things like skilled nursing, doctor's office visit, outpatient surgical procedure, an ER visit, or an ambulance ride. You can actually add a cancer rider onto this plan, or you can do outpatient rehab. These are all the types of concerns you have in terms of out-of-pocket costs on those plans. So this is a great way to do it. Again, you can write this one also on ages 18 through 89. Now, this one is an individual policy, so you wouldn't be able to do it like the cancer policy where you can cover multiple people. Everyone would have to have their own individual policy. So what you can do on a you can pay up to $2,500 for a lump sum hospital confinement, or you can do $300 daily for hospital confinement. Actually, I took that back. It's $700 daily. Gosh, I can't believe the person who updated our presentations has got some bad info in here. I apologize, everyone. I should have looked through it closer. So what you do is whenever you go to offer this policy, you decide what you want to do, whether it be a lump sum or a daily. The lump sum can be up to $2,500. The daily can be up to $700. If you choose daily, you choose the number of days you want to have covered. So again, if you're pairing this up with a Medicare Advantage plan, then you would look at the plan and say, okay, well, this one, look at the summary of benefits and just say, okay, it looks like this is about 5 days that they're exposed. So you could implement in 5 days at, you know, whatever the amount is, up to $700. You could also do the skilled nursing up to $200 a day. You can do a doctor's office visit up to $60 per visit. which that just, pays them back for a doctor visit. So it helps offset co-pays and things like that. If they end up spending time for an outpatient surgical procedure, like they just go in the morning and they're out in the afternoon, you can reimburse them up to $1,500 once per year on that. And then for an ER or ambulance visit or ambulance ride, you can do $200 twice per year on that. And then what this sheet is missing is there's also an outpatient rehab, which you can choose to cover either 15 visits a year or 30 visits a year, and it will cover you $50 per. I know personally, someone that I've dealt with that could have used coverage like this was my aunt. She had a stroke several years ago, and that was one of the kind of shockers to us, is the rehab that she had to go through was just, it was a daily thing going on for, several weeks, and those visits add up. They run about $50 a pop, so that would have really come in handy. That plan wasn't available at that time, or else she would have had it. And then it doesn't mention it here again, but you can also add up to $10,000 in cancer coverage onto this policy as well. Moving on from the hospital indemnity now is going to be our recovery care plan. Now, let me tell you something about this plan and also the next one we're going to cover. Recovery care and home care plus are the two plans. We're going to talk about recovery care first, but before I go into that, I just want to tell you a little bit about what types of plans these are. These are short-term care plans. Now, short-term care plans are not huge in the market right now, but they're catching on, and it's really important. I'm a big believer in these. I think everyone needs to have one. You can write it on anyone between the ages of 50 and 89, by the way. So probably many of you who've been in this business for a while have dealt with at some point, or maybe you still do, in long-term care. Well, long-term care used to be an amazing industry that many, many people did very well in, and help get a lot of people a lot of important coverage. The only kind of difficult thing about that is long-term care has sort of passed its prime now, and it's not the product that it once was. Long-term care, I can't speak today. Long-term care has become way too expensive. It's very, very difficult to afford for many, so most can't afford it. And then even if you can afford it, it's also gotten to be very difficult to get the cases underwritten. So either you're not healthy enough or you can't afford it. That's kind of the general issue with long-term care. Some people still get it, and that's great, but most, have difficulty either affording it or passing the underwriting. So these plans, the recovery care, and then the next one I'm going to tell you about, which is home care plus, they're designed as short-term care plans. And you can get up to 1 to 2 years of coverage in these. They're very affordable, and they're simplified underwriting. So there's not a lot of long, complicated underwriting. It's basically going to be just yes or no questions on these. So recovery care first, it will give the policyholder freedom to use their benefits at a nursing facility, whether it be skilled, intermediate, or custodial, just any level of care that involves a facility, you can apply the benefits to for this. You can assisted living as well. And then you can also build in care for in-home with this product as well. So you can do home care. And here's kind of a breakdown of the product. So for a nursing facility, what would have to happen in order to get the benefits from this, to trigger the benefits, would be if the client cannot perform 2 or more of the activities of daily living. So if and when that happens, or if they have cognitive impairment, then they can collect up to $300 daily, and they can choose the number of days they'd like to have covered. You can do 90 days, 180 days, 270, or 360. So almost a full year if you chose that amount. Remember, the more coverage you choose, the more premium it adds on. But I'm telling you, these plans are extremely affordable. If you go to our website and you run a couple of quotes, you'll see exactly what I'm talking about. You can choose a waiting period if you want, of 0, 20, or 100 days. I don't recommend that. I think you should get them first day coverage. So that's the nursing benefit. And by the way, however many days you choose, you get that total number of days twice. You can reset the total number of days. All you've got to do is go 6 months without using the care, and then it resets your number of days. There is a hospital benefit built into this. It's up to $300 daily. That's not why anybody buys this plan. That's just sort of a byproduct. It's, we built this plan on the chassis of a hospital indemnity, so you can get that. You have to get at least a minimum. which doesn't really add much premium onto it. And then you can also, down at the bottom there, you can add on a home care rider. You will do up to $1,200 a week. You can cover 13, 26, or 52 weeks, with the same caveat of you can reset your number of weeks if you go 6 months without using the product. So you can literally build up to 2 years or really even 4 years into one plan with this product. It's really good. And like I said, your chances of using this at some point in your life is very high. We're all going to, at some point, or not all of us, but more than likely going to encounter a period in our lives where we either need, facility care or we need in-home care. And this plan can do it all. And then I also told you about Home Care Plus. The big thing on this, it's very similar to the recovery care, except it doesn't include the facility portion. It's just home care. You can do up to $1,200 weekly. You can cover 13, 26, 39, or 52 weeks. Choice of a waiting period of 0 or 20 days. I recommend 0-day waiting period. The big thing on this particular product is the underwriting. If you don't remember much about what we talk about during this time today, try to remember this. Our Home Care Plus product has the easiest underwriting of any of our products, with the exception of our DVH, which doesn't have any underwriting. So as far as the products that do involve underwriting, this is the easiest one. You could actually write this Home Care Plus product on someone who's been diagnosed with Parkinson's, someone who's been diagnosed with memory loss, someone diagnosed with Alzheimer's, someone who had cancer, but they've been well for as little as 1 year. All these individuals, you could theoretically write this product on. Those are not going to be exclusive knockouts for this Home Care Plus product. Not saying there isn't other things that may knock them out, because that does happen, but those specifically won't. This is the loosest, easiest underwriting of all our products. Highly recommend you take a look. If you walk in someone's home and you know right off the bat that they want to buy something, but they're not totally healthy, I would go to this product first. All right, and last but not least, our dental, vision, hearing. I'm not going to spend a whole ton of time on it. Just know that we have one. The big thing about it is that most seniors either don't have enough coverage or they can't get it because it's more expensive. Ours you can get for around $30 a month for most seniors. And it's an Aetna branded product, which goes a really long way. I mean, it is a household name. It's a great company, and many want to or prefer to do business with us. So it's dental, vision, and hearing. It will cover anyone. You can write them as little as, it says 0, but you're going to have an adult on the policy. That you can do family. So as long as you have an adult, then all the children can be covered underneath them, or you can do an individual plan if you prefer. Unlike our cancer, heart, stroke plan, the eldest applicant would need to be the primary on this one. Other than that, it is a guaranteed issue product. There's no health questions. It will help with dental, vision, and hearing expenses. You can do either a $1,000 annual plan or a $1,500 annual plan. That's, depending on how much benefit they want. There is a deductible for each person on the plan each year for $100. Once that's paid, then the benefits kick in. They can go to any provider they want, but I'm telling you, your best bet is to utilize the network, because you're going to get not only great coverage from the plan, but by being a member of this plan, you're going to get huge discounts by going in network. So it's really, really best. I can't stress this enough. You're not forced to go in network. You don't have to, but it really makes the most sense to go in network. And our networks are huge. I'm starting at the bottom of the page here, but the dental provider that we work with is Carrington, and they've got a huge network out there. So go to a Carrington dentist to get huge discounts on everything. For hearing, you would go to a True Hearing specialist, TRU Hearing. You're going to get the best discounts and deals there. And then as far as your vision, you go to either an iMed or VSP provider. And then if you're going to apply LASIK to any part of your plan, then you would go to a QualSight provider. Going to any of these types of providers are going to really save them money, in addition to getting great coverage from the plan. Oh, I put that in there twice, sorry. So here's the way the dental works. You have classifications on service. You've got basic, intermediate, and major. So A and B is going to be covered immediately once the deductible is covered, of course. You can get 60% coverage for year one, and then it goes up to 70%. That 60, 70, 80%, that applies to, how much do you spend at the dentist? So like if you went in year one and you racked up $100 bill at the dentist, which isn't a big dentist bill, but let's say it was $100, then we're going to cover $60 of that 100. And then again, in addition to that, if you go to a Carrington provider, we're going to give you better discounts on top of that. Can't stress the discounts enough. Your major work, like endodontics, including root canals, periodontal surgery, bridges, crowns, and full or partial dentures, those will be covered after 12 months. So that's when your benefits kick in for that. So you do have a 12-month waiting period in there. But after that, it kicks in at 60% per visit or per procedure, however you want to look at that. Okay, vision, you can use it after 6 months of the policy being in force. And after that, you can use it every other year. Basically, you can pay, we'll apply $200 towards your lenses and frames and everything. Go to that VSP or iMed network, and you're going to get big, big discounts. You won't pay much at all. I actually was just taking my son to get new glasses a few weeks ago, and I asked about that plan, our plan with this vision provider, which they both accepted iMed and VSP, and they said, oh yeah, you get really good deals. I mean, it knocks a lot off the price of everything whenever you use that plan. So can't recommend it enough for that. And then hearing benefits, there's a 12-month waiting period. After that, we'll pay up to $500 during any one policy year towards hearing exams and hearing aids. Again, if you go to a true hearing specialist, then they will give you big discounts on hearing aids and anything else that you need for your hearing needs. Here's just a real quick comparison between us and some of the other DVH type plans that are out there. You see, this is going to be based on a 68-year-old with a $1,000 benefit plan. For us, that runs about $31.28 a month. And then I won't say the names of the carriers, but you can look at the prices below. They're all pretty much going to be a little more expensive, or in some cases a lot more expensive. And the plans are all about the same. We all have about the same deductibles, same classifications of care, same waiting periods, and then the same co-insurance amounts. So we really have come out with a very competitive and affordable plan. Of all our products other than Medicare Supplement, DVH is our biggest seller since we came out with it about 2 years ago. So it's really been a very good product. We get lots of great feedback on it. Again, any and everything that we talked about today that you want to find additional information on, contact us. And I'm going to give you that phone number here. This is for our agent services. It's 866-272-6630. You can also email us at aetssiinformation@aetna.com. And again, our website is aetnaseniorproducts.com. aetnaseniorproducts.com. Here's the contact information for all the different regional teams we have out there. Like I said earlier, I cover the South. So you have my contact info. If you happen to live in one of the other states outside my region, whether it be our Western or Midwest or Eastern, there's your contacts. You've got Tony Clark in the West, George Spelikanos in the Midwest, and then Jeff Nasser in the East. And then we all have our teams there that are designed to help support you as well. I'll leave this up here for a second in case anyone wants to write down any emails or phone numbers. Okay, moving on. Want to tell you about our sales incentives. So we've got a great program right now where you can earn extra money on top of your commission. You can see that it's broken out for the entire full month of January as well as February and for March. So that's how long these will be going in or will be in place, and then we'll probably announce new ones after that. So you can get a $100 bonus on a MedSup underwritten application, a $25 bonus on an open enrollment application, and then for any of our ancillary products, you can get a $25 bonus on top of your commission as well. Take advantage. That's all I had. We don't have any details on our trip yet. I know a lot of times people are asking about those. So if I could tell you anything, I would, but we just haven't announced anything yet. So other than that, I will say thank you. I will turn it over to John, and I'll stand by if there's any questions later.
And Kevin, actually, I've got 3 I think that would be good to share with the group. The first one, Stephen asked, what considerations should be taken into account when comparing a high deductible F versus the high deductible G plan?
That's a great question. First, let me preface it by saying that we don't sell a lot of either of them at this point, and I don't anticipate that changing in the future, at least not in the immediate future. So it's not something we spend a lot of time or effort on as far as marketing it. But as far as the differences go, it's kind of 6 in one way and half a dozen the other. F is going to be more traditional, like an F plan with more coverage and less out of pocket, but a higher premium. G is going to be a little bit more out of pocket, deductible wise, and a little bit lesser premium.
And I think one other consideration is MACRA as well, where the F won't be available to the newly eligibles. The second one, you might be able to answer this off the top of your head, but the product distribution by the states will be part of the follow-up. But the question is, what products are available in Florida? Do you have anything off your top of your head you could do with that, Kevin? Keeping in mind that
Come back to me on that one.
Yep. Okay.
I know we don't have all products available in Florida. I will look them up, and before you end the call, come back to me and I'll have an answer for you.
Okay. Yeah, Florida is one of those states, like some of the guarantee issue or anniversary states for the Med Sups, or California, New York, or Washington, Missouri, that have their own way of doing things. The third one is, I think it would be good for the group, when you get paid the lump sum of the critical illness policy, or let's extend it beyond that to any of the ancillary products, will you receive a 1099?
Great question, and the answer is no. This is tax-free money.
And that's something that I can actually personally testify for. I had the misfortune of having some health challenges with a critical illness policy in place, and it was nice to receive that check and not be able to put it on this year's tax return. So a nice piece there. Okay. And I think that handles some of the other ones were one-offs, and I think I've got them answered through the system. What we'll do now is give you all a little bit of a highlight of why you would want to offer these programs through us here at Premier, and we'll follow up at the end, Jesse, for your Florida questions as well. Some of the things that come into play when you look at a portfolio of products where, let's say, for instance, one of these offered by Aetna isn't available in the state, but that same product type might be with another carrier. We do offer electronic contracting. Aetna has their own system as well, but this system will give you an opportunity to create an agent profile and then electronically select different carriers and have them auto-filled, so you don't have to go through everything page by page. There's a couple of carriers that are fond of keeping the legalities in the contract year over year, and they can be very long. We don't want you to miss anything that would slow down. This auto-fills it and addresses the old carpal tunnel. And as independent agents, you have the opportunity to offer products from a number of different marketing organizations such as ours, with a number of different carriers that may require different levels of assistance or coverage when it comes to errors and admissions coverage. This program that we offer is available at a discounted rate. It varies by the amount of coverage that's necessary. That's a lot of times dictated by your circumstances and that requirements of the carrier. But it's a great way to make certain that you have that coverage regardless of whom you contract through. There's a few organizations out there that may add you to a blanket coverage for a carrier or two. Keep in mind it doesn't always cover you for everything. So this is something that keeps your hiney in proper perspective. We also want to make certain that you keep your license up to date. So we offer discounted continuing education credits through WebCE in our association with that organization. And as an independent agent, you also maintain your own benefit package. This program here gives you an opportunity to access non-cancelable disability income insurance on a modified guarantee issue basis at a discounted rate where you share in the commission. So that's something that might fit many of you when it comes to self-insuring for disability income. And much as where today's program is being recorded, addressing a particular carrier, we also offer different programs that look at different product types and different marketing ideas to get you in front of the buying population. So you have an audience to preach your gospel. Those are available on our website at premiersmi.com. They're also available on our YouTube channel as well. We do also offer complimentary electronic support for many of the programs that are out there. Our quoting tool through CSG gives you a broad portfolio of products that you can quote all of the programs. Kevin has a great quick quote program for his Aetna Senior Supplemental Products. This gives you another option where you may have gone into a house, let's say in a market that's dominated by one particular MA carrier, but they have those little extras that are needed to make that an all-encompassing program. You can actually select that Medicare Advantage program and fill in the gaps with Aetna's ancillary programs through that program, and it'll tell you just what it takes. It's a really cool way of doing it, and it gives you the opportunity to obtain the scope of appointment electronically, have them fill out everything so you prep the entire conversation, and then is a place to store those scopes electronically for that mandated 10-year program. And remember that 10-year storage is for folks that you've sold and folks that you haven't. It's supposed to be in place for everybody you visit with a Medicare product that requires that scope of appointment. Keep in mind, Med Sups do not, neither do ancillary products, but many times when you speak of a Med Sup, they ask questions about the PDP program, or are there any other options that may require less out-of-pocket per month. Having that signed is a great way to cover yourself and also create an opportunity to discuss additional product. It is also a great way for you to compare different supplemental programs should you choose to do a supplemental review. When you know they have a product with one carrier, it gives you an opportunity to compare it side by side with a couple of other carriers, or one if you're looking for a sale with a particular carrier. We also have our Medicare Center that allows you to do a side-by-side comparison with MA and PDP products. It also acts as a modified CRM for you, and will also give you the opportunity to sell remotely with those products and do so where you have obtained the scope of appointment electronically and stored it here. So some different things that can come into play to make you as successful and as time efficient as possible. We also have a program called Coverage Made Easy that allows you to put your social media marketing programs on autopilot, and a way of taking all of this information from all these different carriers and placing them in a central place where you have the information for those extras, those bonus programs, in a manner of speaking, the extra marketing incentives that Kevin mentioned with the Med Sups and the ancillary products. It's also an opportunity for the trips. So when Aetna has their detail together for these programs, it will be located here as well. And keep in mind, all that production with Aetna and other carriers helps you qualify for Premier's trip, which this year in April is a cruise from the Miami to the Bahamas. So much as where Aetna hasn't got all their details for you for the 2021 trip, boy, that's hard to say. The information on Premier's trip is in a similar situation for that 2021, about to be announced, from what I understand, by the end of January, but we'll get it to you as we can. Some additional help in getting out in front of folks. We do have contact lists available to you at a greatly reduced price, butted up against the do not call list, or for no cost, depending upon your contracting situation with your organization. We have different programs to help you market into the community. The retail marketing programs with the different carriers. Aetna has one with CVS. The Walmart program extended past the annual election period and was available for agents that were involved for OEP as well. And we have different programs that also help you engage with different centers of influence in the community, such as faith-based organizations. We have an upcoming webinar on that, a recording on the website as well, where you have a track to follow in order to utilize a very strong influencer within your community, as is the program with provider marketing. This goes beyond just the Medicare doctors that provide the care for those programs that we offer, but also on how to market to dentists and other influencers and providers of care in the community. Many of the carriers also at certain times of the year may have different lead programs as well, and we do have Facebook leads, internet leads available for you. Very well polished in the final expense area, just opening up in the Medicare space. If you have an opportunity to work in the final expense arena, we've got a great program in place for you. And there's a guy that sits a couple of offices down from me that knows those programs in and out and would be a great resource for you. We also offer direct mail support with deep discounts based on production. This allows you to set a routine and offer this program consistently based on your production. It can really drive down those costs. We have 5 carriers or 5 vendors that are preferred vendors, and we do it that way because if you're dealing in the Medicare space, we want to make certain that we keep you compliant as well. All said and done, we want an opportunity to work for you and with you, and we're asking for that opportunity. So if what you've heard today could be a very good addition to your personal marketing program, or if you're looking just to a way to better utilize that contract you've already got in place, let's get some of those details in play. And as they say on the John Wayne movie, The Cowboys, we're burning daylight. We don't need to procrastinate. We just put her in gear. That said, you can reach any of us here at Premier at 1-800-365-8208 or through our website at premiersmi.com. We look forward to the opportunity to speak with you. Remember that the follow-up is coming for you, and I'm going to touch base back with Kevin to see if he's got a quick answer for us for Florida, and if not, we'll make certain that that state grid goes out regardless. Kevin?
Hey, thanks, John. I did get the answer for Florida. So we have our Medicare Supplement, which has a 7% household discount. Just thought you might want to have that additional information there. We also have final expense, cancer, heart attack, stroke plus, dental, vision, hearing, but not the full version. We have dental only in Florida. So just a dental only product. I think we probably don't call it dental, vision, hearing, of course. So dental only, and then of course we have the hospital indemnity flex. So everything with the exception of the short-term care plans.
Awesome. Jesse will make certain that you see that in writing as part of the follow-up that we sent you to. And we look forward to discussing the possibilities we have with Aetna Senior Supplemental Products with each and every one of you. I want to thank you for the time you've invested with us here today. We look forward to visiting with you down the road. Kevin, we thank you as always for your great presentation, and we wish you all good selling. Thanks so very much, and we'll talk to you all soon.